Welcome to our Medical Spanish event. Are you guys excited? Milan is like right around the corner, which is physically and also figuratively true. Just want to say welcome, and we will kick off our cultural competency event first with my friend Chris Landa. For those of you that don't know her, she is an English teacher in Milan, and she's also our classmate Dan Braunbrenner's wife. So please give her a round, what's it called? Applause. Applause. English is not my first language, I'm sorry. And that's very relevant, I guess, to today.
It is.
But
I use that excuse too. It's all good.
nice. And yeah, she's just going to tell us a little bit about Milan. So welcome, Chris.
Hi, everyone. I work in Milan as a high school English teacher. I teach 11th and 12th grade. I've only been there for a year and a half, so I guess I can give you guys a little bit of perspective from kind of like an outsider's point of view going into the town. It is a town that I would say, well, it's a small town, and with that comes some challenges of just a rural environment. It has a pretty high poverty rate, if you don't know that already. At least at our school, we have from like maybe at 87% free and reduced lunch rate. So pretty much nearing what you think of as like an inner city poverty rate we have at our school. It's just rural. And rural poverty is really different than urban poverty. I moved here from New York City, so I had experience with urban poverty, and I was not well versed in rural poverty, so it's definitely different. But not only do we have the issues of poverty in the town, we do have these two very different cultures kind of colliding in this one place. So Milan, many years ago, was all white town. It was like farmers in middle America. Some of them are like self-described rednecks. Proudly so, they will say. And so to have that kind of be the roots of the town, just like try to keep that in mind. Pickup trucks, camouflage, hunting, that, like that's their regular day-to-day life. And then in comes this new population of immigrants, and it's really interesting to see how those worlds collide as a teacher, but just in general in the town. So now the town is almost 50% Hispanic, and our elementary school is now majority minority. We just kind of tipped the edge, I guess, last year. So the Latino population in Milan, though, has now like kind of gained strength, I would say, and they strength in numbers, but also in that they've been there for much longer. And now we have a new wave of immigrants coming from various African countries, and that's kind of the new like, oh, we don't know what to do with this moment for the town. So yeah, that's a little bit about the kind of demographics, I guess. High poverty, high immigrant population. The immigrants mostly work at farmland, which is a hog processing plant. It's huge. You can kind of see it if you drive in a certain way. It looks like a prison. It's enormous. But it's a meat processing plant, and most of their employees, I would say, are immigrants, and that's why we have such a high immigrant population. The other thing I'll say is that Milan, interestingly enough, even though it feels really unique to have this kind of like really diverse town in northeast Missouri, there are towns just like it in Iowa, and there are towns just like it in southern Missouri, and there's towns just like it in parts of the South. Actually, the fastest growing immigrant populations are in really small towns in the Southeast and the Midwest, and usually these towns are like not used to newcomers, especially places like infrastructure, like schools and medical places. They are not used to having this kind of new population. So been kind of seeing how they deal with it. I am a Spanish speaker. I actually grew up in a Spanish-speaking household, and it was my first language. But I teach English, which all the kids like to remind me that it's weird because the Spanish teacher is white and she learned Spanish in college, and I'm Hispanic and I teach English and they don't understand why don't we switch. But I'm the only native Spanish speaker that's a full-time teacher, kindergarten through 12th grade. We have 2 interpreters that work at the school that are incredible, but they are not considered like faculty because they don't have their college degrees. They don't teach classes necessarily the way I do. So it's kind of crazy to be that person, I guess. I mean, the Spanish teacher obviously speaks Spanish as well, but she's not like a native speaker. So yeah, I play interpreter a lot, I guess, at the school inevitably. But that's a little bit about the population. And I don't know, I guess if there's any questions now, or should I wait till the end? If there's any questions about what it's like to teach in this very bizarre town, that's awesome. I love teaching there, and I love the kids. So if there's any questions. Yeah?
You kind of touched on like that they experience like a clash of 2 cultures. Like, what do you see being like just like the most common struggles that these populations are dealing with?
To be honest, I was gonna I thought about showing this picture that I felt was somewhat symbolic of that clash. In the homecoming parade 2 weeks ago, we had a community member make a float that had a pickup truck with lots of American flags on it and a Trump 2016 sign on it, and it said Wildcats USA Made on the side. And like probably 85% of the JV football team is not what I would classify as USA Made, at least maybe not what that person would classify as USA Made. So it's manifested in weird times where, and I was like standing next to all Hispanic families, like watching it go by, and I was like, this is so crazy. So sometimes it comes out in weird places. In sports games, like a lot of the time you see that like clash, I guess. Like teams will make fun of us using racial slurs a lot of the time. But I find a lot of hope in the students. They date each other, they're friends with each other. There's not that like segregation within the student body, and that kind of gives me hope for the town. I think you see it a lot more in the parents and in the adults. I don't know if that answers your question.
Yeah.
Any other questions? No. All right, cool. My students have way more questions than you guys. Yeah.
So, I know you said that 87% of the student body is on prayer use lunches.
Mm-hmm.
Do you see a lot? I know you work with the high school level, but do you see a lot of kids like not being like well nourished at home and like coming without eating breakfast and things like that?
Yes, all the time. I think, well, the school provides breakfast as well. So usually they'll have breakfast and lunch. I have several students where like those are their 2 meals. We have like, I think last I heard 57 students on our homeless list. And it's not a big, the high school has less than 200. So just to like give you a picture, that 57 is kindergarten through 12th grade, but that's still like a pretty significant chunk of your population. Homeless meaning that they could be living at an aunt's house or they could be living at a friend's house, but we don't have like a guardian for them. So yeah, and then the other thing I would say that this was like a change from my perspective is oftentimes my like lowest economic group are not my immigrant students actually. They're the white students. So because the immigrant students, most of the time, both of their parents work at farmland and they start off with $15 an hour. So anyways, they're not always my like not eating at home students. I actually can't think of any that are Hispanic that don't have regular meals at home, I would say. They might not be eating healthy meals, but yeah. Any other questions? Yeah.
Has Milan had a French population come in too recently?
Yes.
Do you have like a French teacher at school? Or?
No. Well, I think our music teacher has some French, but like not very much. Yeah, so we have the 2 Spanish interpreters. No, we have 3, sorry. We had one that started midway last year. So we have 3 Spanish interpreters, like one that focuses on lower elementary, 1 middle school, and 1 high school. And they're interpreters, but they also are paraprofessionals, so they go into the classroom and help interpret for the students as well. So they wear many hats, those 3 individuals, and they're incredible people. I have a ton of respect for them. But we don't have any French interpreters, which is why it's causing like crazy panic. But I don't think it's warranted, the crazy panic, but yeah.
How many French-speaking students do you think you have like kindergarten through 12 right now?
6,
Oh.
maybe? Not that many.
Okay.
We have students who speak other African dialects, but they came earlier. Like the student I'm thinking of, she's a freshman, and she's been here for long enough, and they caught on English really quickly because they didn't have anyone else that spoke their native language. Whereas our Spanish speakers, like they can kind of get away with speaking to each other in Spanish for much longer, so it can take them longer to learn English. Any other questions? Yeah?
So, probably, do you have like big communication issues too with parents who don't speak any English at all? I mean, how big of a hurdle is that for you trying to just like do your job? Because you get the kids in there and they're learning English and they're, if the parents don't, I mean.
Yeah. I'm lucky in that I speak Spanish,
right.
I would say. It can be a hurdle, definitely, for teachers. During parent-teacher conferences, we have interpreters there. Sometimes the students interpret for their parents, which you can imagine if you're trying to tell your parent, hey, your student's failing your class, and that student gets to interpret for their parent. They may or may not want to include that detail into their interpretation. And I've had students tell me, oh man, I'm not going to be able to lie to my parents the way I could last year because you understand it. I'm like, yeah, you shouldn't do that. That's not right. But anyways, they're high schoolers. So it is a challenge, definitely. In my opinion, and this is just my personal opinion, there's a bigger challenge in terms of feeling like you can advocate for your child and that you can reach out to teachers and that you can demand changes. There's a bigger issue of that kind of privilege to do that than there is a language barrier. That's my, like, I wish, I talked to some parents and I'm like, they tell me these stories of what happened in a different classroom and I'm like, why didn't you call the principal? You know what I mean? Or like, why? And it's like, there's something stopping them from if they showed up, there'd be an interpreter right there. You know what I mean? So I really push like advocacy on my students. Like they need to self-advocate, and it's something that you have to learn. You have to learn how to do that, and it's hard to teach it, and it's hard to learn it. Yeah.
Have you noticed that parents and students come to you with those kinds of problems in other classrooms that they don't understand and come to you because you can speak Spanish?
Yeah. I had a parent last year show up in the middle of my lunch because she had been laid off at Farmland, I think 2 weeks prior. So she had more time on our hands than the usual like 12-hour day there. But she showed up in the middle of my lunch because her daughter had told her that her English teacher spoke Spanish and she didn't believe her. And so she just wanted to come to see if it was true. But yeah, then once they find out, you hear things, and the students too. Like some of the English language learner students will tell me things that happen in classrooms that because I speak Spanish, that it's like they think I will understand it more. Yeah, are we okay on time, or should I stop? One last question.
So if you have a lot of students with parents working 12-hour days, what do they do for after-school care?
Go home. Sometimes like it's a lot of siblings. Like siblings taking care of younger siblings, or cousins taking care of younger siblings. I don't know as well, because I have 11th and 12th graders who like drive off by themselves or play football or whatever they do. So, yeah.
I'll make this introduction really quick. We have with us Dr. Carmen Perez Munoz from Truman State University, and she's going to talk about working with interpreters and translators. We were really lucky to have Chris here tonight too, so I think this will be a really helpful introduction for you in terms of the work Saturday.
This thing. Can you hear me? Yeah? Okay. Awesome. All right. Well, first of all, thank you for having me. It's super exciting to be able to talk to you guys. I hope I can tell you some things that you don't know necessarily already. And of course, at the end, if you have any questions, comments, suggestions, anything, I'll take them gladly. All right. So yeah, I've been asked to talk to you guys about working with interpreters, and that can be a tricky topic in different ways. So we're going to see how and why. First of all, why do we need interpreters if it's not already pretty obvious? I don't know if you're going to be able to see everything down to here, so if you need it, I'll explain it more to you. But anyway, as you see, according to the US Census, more than 63 million people in America don't speak English as their first language. And actually, considering that you don't even have an official language, we kind of really complain about it, although some people like doing that. But yeah, these are some of the states that have the highest population of non-English speakers, and that tells you how important it is, especially for a profession like yours. Whether you can speak in English or not, and I, for instance, consider myself able to do it, when it comes to dealing with health issues, I would always prefer to speak in my first language. So keep in mind that some people might be able to have some communication with you, but they might prefer to have somebody that can speak to them in their native language, just to make sure that they get all of the information right. So that's one of the things to keep in mind. Second thing, what is an interpreter? Translators and interpreters are two different things. Translators work with written texts, and that gives them the advantage of having time to think the best way in which they can translate something into another language. However, when you're dealing with interpreters, they're going to be translated right there on the spot, and they're not going to have a lot of time to go through their minds about the best word or the best syntax to translate this or that. So what they do actually is even more difficult than what translators do. As it has been already mentioned, it is very common to use children and younger people in the family that might be more fluent in English to translate for their parents or their elder, and that should never happen. That is not a good idea for many different reasons. And I could give you many different examples, but there was one in Massachusetts not that long ago. This girl, she was already a high schooler, like I think she was 14 or so. She had been translating for her mom for several sessions with her doctor, but she selected the information that she translated both for the doctor and for the mom. And after a couple of months, the mom didn't know that she had terminal liver cancer. So that kind of thing happens because the family member does not want to give that sort of information. But at the same time, regardless of accuracy, like, you need to think about the pressure that you put in that person, having to communicate that kind of very sensitive information to their parents or their grandparents. So for the benefit of everybody, if you have the access to interpreting services, use them. because they are extremely useful. Most hospitals in the US at this point have somebody, some part of their staff that can do translation or interpretation. In general, the ideal thing is to have people that specifically do that, and not only a nurse that speaks Spanish or somebody else that lived for a while in Congo. Like, you cannot trust people to necessarily know exactly how to translate specific things. Being bilingual does not mean that you're qualified to be an interpreter. There's training for it for a reason. So that also means if you guys have some knowledge of some other language, be really honest when evaluating your own skills and being able to communicate with other people in that language, because you might not have the easiness to do it in the best way. One of the examples of the importance of training, it's right here, and I copied it for you guys. A clinician communicated in French to a Haitian patient who spoke only Creole, and the Haitian interpreters noted that in French, stomac means stomach, but in Creole, the similar sounding word l'estomac refers to the chest. So that can lead to a lot of confusion, pretty obviously. So those are kind of like little things that you need to keep in mind. Again, being aware of how much of the language you know, how much you can communicate, and using somebody that has the skills and the training to actually do it for you in the most efficient way. So I don't need to convince anybody of how important it is to have an interpreter. I think that everybody knows that. But I don't think that most people know how to use them in an effective way. And that's not something that difficult to learn, honestly. It's a little bit of common sense and a little bit of researching and finding out the best practices. The first thing you need to do, wherever it is you end up working, before you have the situation of having a foreign patient or somebody that doesn't speak English, is make sure you know what resources are available for you. If you have interpreting services within those premises, if they have some company that they use for phone interpretation, which is something that has become pretty common today. Things like that. If they don't have any of that, if it's a small clinic or some area that doesn't have the funds to have a specific department for interpretation, maybe some staff member is going to be your second best choice. So make sure that you know those things in advance. So if you have some sort of emergency case, you're not completely blank, not knowing what to do, but you know exactly where to go to find some help. If you can, use the same interpreter normally, especially with the same patient. Because one of the main issues that you're going to have, and we're going to talk about this in a second, is building that kind of relationship with your patient. Since you have an intermediary, it's going to be really hard to have them see you as the person helping them. They're going to see the interpreter as the person helping them. And so having always the same person and you two working as a team makes the patient be able to identify you two as a combo that is going to help them. And that way it's going to be easier to get that connection. Remember too that although it might be obviously a little bit of an issue, the fact that you're going to need somebody to communicate with your patient, don't feel like the patient is a burden or a problem in any way. Actually think about it also from the point of view of the patient. Many people feel some sort of sense of not being adequate because they're going to need somebody. This is adults normally. They're going to need somebody to help them communicate with a doctor. It's kind of like embarrassing. And so they're going to start from a situation in which they're not going to feel comfortable about needing help. Nobody likes getting help, right? So be also understanding of the point of view of the patient about using an interpreter to communicate with their doctor. In my experience, which doesn't mean necessarily that this is the rule, many times I've seen, at least at UNC hospitals, which is where I got most of my experience with this kind of thing, some sort of battle in between doctors and interpreters, like the interpreters don't know what I'm doing, or the doctors thinking, or the interpreters thinking the doctors don't understand how important it is what I do. I think that there should be a respect, obviously, from both sides. You guys are professionals, but you need to acknowledge that they're professionals as well. And again, that working as a team is going to be extremely relevant to make the interview with the patient go in the best possible way. And related to this connecting with the patient, it is extremely important that the interpreter does not interact with the patient without you being there as well. The interpreter can interpret, of course, can translate everything that you say, but that doesn't mean that they are medically trained. And if they have that contact with the patient without you being there, since they speak the same language, the patient is going to start developing this connection with the interpreter, and you're going to be the outsider. You, as their provider, you should never be in that situation. You always want to be there with them, so that it's kind of like a group thing. What else? There are 3 stages, pretty obviously, 3 stages in which you need to have a set of goals on what to do when working with their interpreter in the most effective way. Before the interview, you should meet with your interpreter. Give them time to, unless you're in an emergency room, of course, and things are a little bit different, have them have time to know exactly what is going to happen. Discuss with them what you want to happen in this specific interview. Is it going to be just a regular checkup? Are you delivering some sort of news? Are you giving a diagnostic? Are you going to tell them what kind of tests you're going to run or something like that? Make sure that the interpreter knows what's going to happen during this session. And what are your goals? What do you want the patient to know, to understand? Do you need some sort of form, sign, some permission? Make sure that all of that is very clear from the beginning. One of the most important things, and there's no standard for this, one of the most important things that you need to discuss in advance is going to be your seating arrangement, which I know sounds kind of stupid or basic, but it is extremely important. You need to be in a position in which you can look directly at your patient, which is pretty basic, right? However, where does the interpreter sit? Where does he or she go? I've been in really awkward situations in which you can have, for instance, the doctor sitting here, patient sitting here. Where would you put your interpreter? First reactions? I don't know. If you put him in the middle, most likely the patient is not even going to look at you. They're just going to be addressing the interpreter, because that's going to be their reaction. You talk to the person that you know can understand you. It's pretty, you don't even think about it. Many interpreters sit kind of like behind the doctor, so that the patient is forced to look at the doctor in some way, which is a good tactic. But again, it depends on the preference of the people involved. Some other interpreters that I've worked with prefer to sit behind the patient, so that the patient doesn't ever look at them. And in many times I've heard them say, I'm just a voice here, I'm not present, you just have to listen to me. In my opinion, that's really weird, because again, you have the tendency, you have the tendency to look at the person speaking. So if I'm the patient and I'm sitting here, the doctor has told me something and now the interpreter is translating, do I just stare at my doctor while I'm hearing this voice in here in the back? It's kind of strange. So in my opinion, sitting behind the doctor doesn't only help with the eye contact situation, but also with the doctor and interpreter being a team helping the patient. So that's my personal opinion, but definitely that should be something that you discuss with your interpreter beforehand. You don't want to have that moment when you enter the room and you're like, you sit in there? Okay, I'll sit in here. No, you want to know where you're going to be to make sure that all of that goes pretty smoothly. If you're working with an interpreter that has been specifically trained for medical interpretation, they're going to know about confidentiality. No, you're not going to have to discuss that with them. But if you haven't, maybe if it's just a regular interpreter that might be in this situation right now, you might want to double check with them that this is a confidential thing and they're not going to be able to share that information with anyone, obviously. And also you're going to mention that to the patient when you enter the room, that even though you have an extra person in there, every piece of information is going to be confidential. Most interpreters would take notes while they're working, which is always encouraged. It's a wonderful idea to keep organized the information you're going to deliver. But those notes also are confidential. So you should discuss beforehand if you're going to store them, if they're going to burn them. I don't know what they're going to do, but they cannot just leave or lay around or anything like that. One good way to establish some sort of first connection with the patient is learning your greetings in whichever language the patient speaks, and also learning how to pronounce their names correctly. I'm not going to say insulting, but it's really frustrating for speakers of other languages when people just butcher their names. And so it's kind of like a sign of respect. And you want to do that to make them see that you care enough to do that. And also ask your interpreter if they need anything in particular, if they have some practice that they like doing, if they have any specific requests, and if they have any advice for you, some cultural aspect that maybe you should be aware of and they know and you don't. So make sure that you get all of that information in advance, and that's going to help the difficult part, which is the actual interview, go more smoothly. Of course, as I just mentioned, when you get there, greet your patient in their native language the best you can. You don't have to, nobody's expecting any perfect pronunciation or anything, but again, it's just nice to get that. And ask them how they prefer to be addressed. Not everybody wants to go by Mr. or Mrs. whatever. Maybe they just prefer their first name. So ask them how they want how they want you to call them. Make sure that the roles are clear. Make sure that they don't think that the interpreter is another doctor that happens to know Spanish and he's also here, because they can get confused. Sometimes they're gonna ask the interpreter medical questions, and they should not be doing that. You guys are the doctors, the interpreters are the intermediary. So make sure that the roles are clear and that they know that you're the doctor, they are the interpreters. From the very beginning, you should make sure that the patient and the interpreter know that they can ask questions at any point. They don't have to wait for the whole thing to be over. You want to give them that freedom, because also that way you imply that you're listening, even if you don't know what you're listening to until a few minutes pass by. And then there's the problem of eye contact. As I mentioned before, depending on the seating arrangement, you might find yourself wondering where to look. You need to be focusing on the patient. When the interpreter is talking, I mean, you don't want to stare at them in the eye, that would be a little bit strange, but at least be looking at them. The patient is going to have a tendency to not look at you. And you're going to have to deal with that, but you're going to have to reinforce that kind of connection by you being the one leading that eye contact situation. So depending on if it's a one-time thing or if it's a patient that you're going to see regularly, things might change as they get used to having the interpreter in the room, knowing that they're not necessarily the doctor. Be really careful with your body language. We have this tendency, in general, as humans, to smile at people when we don't really understand them, because we want to be nice. We want to kind of mean the, I don't know what you're saying, but I'm sure it's great. And, and maybe they can misunderstand that for you guys being positive about something that is happening, but maybe you're actually concerned because you need to run some tests and you don't know what's going to happen. So be really careful with that kind of thing. And also, depending on who you're seeing, I obviously have more experience with Hispanic patients. I've been in situations in which the doctor was pretty far away from the patient, and I know that Americans are obsessed with personal space and all of that, but if I have a doctor that is kind of like on the other side of the room, my first reaction is, I have something contagious, this guy does not want to be near me, and I'm dying, probably. That's happening. No, depending on, again, the culture of the person talking to you. I'm rearranging your shirts constantly, I'm sorry. You might want to keep in mind that kind of thing and maybe sit closer to them to give them that sort of confidence that, hey, I'm here for you, I can help. So keep that kind of thing in mind as well. If you're gonna have to give them some sort of form, if you want to write some instructions for them to follow or something like that, if you can have them in Spanish, it would be wonderful. If the place where you work doesn't have those available in the language, maybe you can actually talk to the interpreter beforehand and ask them, would you be able to have this translated so that they can take them home in Spanish or in French or in whatever it is. And that way they don't need to only remember everything that you told them during the session, but they can actually go back to the actual document and read it in their first language. These encounters are normally more complicated than the regular ones, so make sure that you leave some extra time in case something happens or in case the patient, has a question or many questions. You want to have that flexibility. You don't want to look like you're in a rush and you really need to get out of there. Because even if it's not the case, many times the patient is going to feel that, oh, this is with me because I'm not as important, because the guy cannot understand me. It's a tendency that we have to see our minority as the reason why things happen many times. And it's not the case most times, so make sure that they understand that. This is actually a practice that I'm sure that you guys have also for American patients, like, at the end telling them, can you give me a summary of what we have discussed to make sure that they understand? With non-native patients, you want to make sure that you do that. You want to make sure that whatever it is that they had to learn or get from the session with you, ask them to repeat it, like, okay, is it clear? Would you give me a summary of what we just discussed, just to make sure that I made myself clear? You don't want to sound patronizing. You don't want to sound like, okay, I don't know if you're gonna get this. Try and repeat it. Make it more casual. And yeah, that's a good way to know if they got it, and also for the interpreter to know if they've been doing a good job. Now, we haven't discussed the obvious, the language part. One thing, do not think out loud. Everything that you say will be and should be translated. So don't just kind of like be like, well, this is something that I shouldn't tell you, but honestly, no. If the patient shouldn't know it, if it's not something relevant to them, do not say it. Just don't. So stop yourselves before you do it. And that also takes me to the very basic, speaking to someone very loud and very slowly in a language that they don't know does not help them understand. I can give you this presentation in Spanish very slowly, and I'm sure that many of you will not get a word. So don't do that. Just speak in a normal tone, normal kind of language, just make it as standard as possible. Also, use the regular pronouns that you would use with another patient. Use I and use you. Don't do anything like, ask her how she's been feeling lately. You don't want, no. The interpreter, again, is like a voice, but you don't address them. You address your patient directly. You also don't say, we think that, no, not we. I think that you need this test, or that maybe you have this and that. So make sure that you use the same pronouns you would use with a native patient. Be clear in your explanations. Use short sentences, not only for the patient. Honestly, it's more for the interpreter so that they can get the ideas more clearly. But don't oversimplify. Make sure that you give all of the necessary information. If you oversimplify things, you may be skipping information, or you might give the patient that maybe what they're dealing with is not such a huge issue. So you want to treat them, again, I insist, like a regular patient. Don't do anything that you wouldn't do with a native speaker. For obvious reasons, avoid any idiomatic expressions, metaphors. No, metaphors are awful to translate. Or jargon, technical things. That's something that you also know that you shouldn't do with native, English natives. You don't use medical terms. That's great for you and your friends, but don't do that. That scares people away and makes them feel like they're not included really in the conversation. Make frequent pauses so that the interpreter has time to put together his thoughts or her thoughts and organize things, and that also gives you the possibility of making sure that they're following with a good rhythm and that you are having a good rhythm. That way you can also check about your speed both with the patient and the interpreter. It is pretty easy in a situation like this, even when you're not trying to, it is pretty easy to sound like you have some sort of patronizing attitude. So sometimes it's good to be like extra professional, and maybe you think that you should be nicer. No, you don't need to be nicer. You need to be nice. You don't need to be more professional. You need to be professional, but you need to look. You need to make sure that the patient is not going to misinterpret any of your words, any of your moves, any of your tones. Because again, they're going to think in their minds, the first reaction is this person treating me this way because I cannot speak the language, or is it because this is his personality? So make sure that there's no question, that there's no doubt that you're being professional. And then, you know, sometimes we need to ask really personal or even awkward questions about what color has your poop been in the last couple of days. I mean, that's not just something that you ask lightly. So it's a good practice to give some introduction to that kind of question. Especially, for instance, if you happen to have a pretty Catholic, conservative Hispanic patient, and all of a sudden you need to ask questions about their sexual history, it is not going to be an easy conversation. So you're going to have to say, I'm going to ask you some questions now that I ask all of my patients that present these symptoms, blah, blah, blah. Just to make sure that they understand that this is something that you need to do, and it's not that you're a very curious person, you just professionally have to ask them this, and that way you prepare them. And also they feel like you know that for them it can be difficult to talk about specific topics. So these are the main things that you're going to have to keep in mind, language related. But finally, after the interview, again, talk to your interpreter. Maybe they caught something that you were not aware of. Maybe by some tone or some behavior, they noticed something that can help you, and you might have not noticed. However, during the interview, the interpreter, cannot tell you any of that. During the interview, the only things, the only words that the interpreter is going to say come from you or the patient. They don't have their own voice. So the only moment in which they're going to be able to share that extra information with you is going to be after the interview, and you're going to want to take as much of that information as possible. Ask them for feedback, not only about the interview itself, but also what things can you do to improve your connection with the patient. What things can you do to make the interpreter thing go more smoothly? Especially if you ask at the beginning, it's going to help you later on when you have more contact with other interpreters, and it's going to help your encounters with the patients go much more smoothly. If you need follow-up encounters, I go back to what I mentioned before. It would be nice if you could schedule them with the same interpreter, so that the patient, again, has that familiarity with both of you and can see both of you as a combo that is helping them. And finally, this is pretty stupid, but it helps, thank the interpreter. Make sure that they know that you really appreciate the work that they're doing, and you don't just take it for granted as a service because you're working for me, because I need you. They are tools, they are very useful tools, but even tools like being thanked for what they do. So make sure that you do that, and that will lead you to having a much better collaboration with them throughout the years. And I don't know if I went too slow or too fast or what, but if you guys have any questions, comments, feedback, I'll take it. Yes?
You mentioned using telephone interpretive services. Do you have any comments on making that go better, or any tips?
Honestly, I mean, for obvious reason, I don't like it as much as when you have somebody there, but unfortunately for many clinics and hospitals is the only choice. It would be pretty much the same, make sure that you have that talk with the interpreter before you're actually with the patient in the room. But also when you are with the patient and the interpreter in the phone call, you may want to communicate the interpreter something that you see. You can say something like, okay, when we mentioned such and such test, the patient seemed uneasy. Would you please tell them that this is a very simple procedure, blah, 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 blah. So you might want to be more descriptive in your communication with them because they do not have the ability to see any reactions of what might be going on. So that's probably one of the few additions that you would make. But other than that, everything would follow pretty much the same procedure, yeah. Alrighty? If you guys want to talk to me, you can also email me, you can do whatever. But I think that since we're a little bit short on time, we're gonna stop it in here. Alrighty? Thank you. All right. Let me, so, boom. Perfect.
All right, guys. At this point, I'd like to welcome Axel Fuentes and our generous workers who took time out of their day to come down here. Bienvenidos.
Acércame, familia. Esto es de firma. ¿Quieren con poca luz? ¿Qué? Mucha luz. ¿Están siendo de nosotros? No, de nosotros. ¿Estás de aquí, amor?
Las hojitas que están ahí, porque como ellos van a estar filmando, entonces es un consentimiento que ustedes están de acuerdo para filmar. Necesitan nada más.
No trae micro,
¿Ah? Ahí hay lapiceros, sus lentes. Con los ojos cerrados. Los ojos cerrados.
La pluma. Ay, tú me lo das. La preciosa.
Vamos a esperar que pase el lapicero. Ven, no hay pena.
El nombre en mayúscula.
Aquí tu nombre, aquí la firma.
Del molde y del mes 9, ¿verdad?
10.
Es el mes 10. ¿Qué tal?
Toda la fecha también. Toda la fecha, ¿no?
Sí, sí.
¿O sí?
Yo no. 8.
Hoy 10.
10, 8. Sí. A nosotros nos van a hacer preguntas.
Pero también
¿Qué clase de preguntas nos van a hacer?
No le echen leña porque ya sé, a mí me dieron unas que Ok, de acuerdo. Sí, listos.
Alright, we'll get started.
¿De dónde viene? ¿En qué trabaja? ¿Y cuál es su país de origen? Where are you from? Where do you work? And in what country were you raised?
Yo vengo de Milan, Missouri. Ella es mi esposa. Nosotros somos de El Salvador. Llegué a Milan en el 2010. ¿Tú llegaste, amor? 2008, pues, ¿qué llegaste ahí? Ella llegó en 2008 y yo en 2010. Nosotros venimos de la ciudad de Emporia, Kansas. Ya lo movimos. Y allí estamos. El 7 de septiembre del 2011 nos casamos, gracias a Dios. Y hasta la fecha de ahora, pues acá estamos juntos. Y es todo.
Gracias.
Pero, ¿cómo se llaman ustedes?
Oh, sí, perdón. Mi nombre es, perdonen por la ética, porque yo no tengo cierto nivel de estudio.
No, no importa. Puede hablar
Apenas
cualquiera.
crucé el 5. Pero mi nombre es Santos Montoya. El nombre de mi esposa es Virginia. Bueno, como ya mi apellido ya es Montoya. Ella es Virginia Medina. Pero ella ya mi apellido es Montoya ella.
Mucho gusto.
Ok, gracias.
Mi nombre es Miguel Ornelas. Yo vengo de Milan. Llegué a Milan en el 2008. Yo tengo aquí aproximadamente en Estados Unidos como 20, 25 años. He trabajado en varias plantas. Y aquí parece que nos aclimatamos tantito por motivo de que aquí estoy, aquí conocí yo a mi señora. Y nos estamos nomás así en unión libre, pero estamos viviendo a gusto.
¿Me puede decir de dónde? ¿De dónde dijo que era? ¿De qué país?
Soy de Guadalajara, un pueblito que se llama Jamay, pegado a Chaparra.
So, I don't know if you guys understood. He said that he's from Mexico, Guadalajara. He's been here for like 20 something years and he has worked in like the same type of companies over the years. And he's not married, but he has a significant other that he lives with here. So, and the first, I think you guys understood they're a couple. I forgot what he said. He said that he's from El Salvador, and they recently got married. They got married in September.
Congratulations.
Yeah. I don't know.
2008?
Yeah, I think he moved here.
2008, 2011,
Yeah.
so that's our.
Yo soy Marta Guillén. Yo soy de Chiapas, México, en Comitán, Chiapas. Y vengo también del Paso, Texas, a trabajar aquí a Maryland. Y aquí me he quedado también. Ya tenemos aquí como 24 años o 25 años. Pero he trabajado en otras partes de Estados Unidos, no nomás aquí. Y aquí andamos, gracias a Dios.
Okay, so she originally lived in Texas and then she moved here. She said that she has not only worked here, but she has worked in other parts of the U.S. and she has been here for like 20 to 24 years. ¿Y cómo se llama usted?
Marta Guillén.
Marta Guillén. Me gusta su nombre.
Mi nombre es Marta Muñoz. Vengo de Durango, México. Tengo 15 años viviendo en Maryland. 6 años atrás viví en Texas. Trabajo para Farland Food.
Okay, so you guys heard her name, right? She's from Durango, Mexico. She lived in Texas and then she moved here and she's been here for 15 years and she works at Farmland. I know. Okay. So just everyone can say their name or do you want?
Yeah, maybe just so everyone knows who each
Okay. ¿Ustedes cada uno puede decir su nombre?
Sí, ¿cómo no?
Sí, su nombre.
Completo.
Ajá, su nombre.
Ok, mi nombre completo es Santos Reyes Montoya Martínez. Es bien largo. Porque Santos y Reyes son nombres. Entonces Montoya y Martínez son apellidos.
So did you guys understand why it's so long? Because he has like a first name, a middle name, and then he has like two last names.
O sea que Reyes lo llevo porque nací el 6 de enero, supuestamente, ¿verdad? Mis padres. Por eso me pusieron Reyes.
So they named him Reyes because he was born in January 6th, and that's when like Hispanics they celebrate like I don't know how to say that. Yeah. Mm-hmm. No lo tienes que decir completo, primero y segundo nombre, está bien.
Me llamo Virginia Montoya.
No completo, aparte. Bueno, no sé
Está
si,
bien,
si te
está
queda. Bueno, yo pensé que le iba a decir normal, o sea, pensé que iba a decir el nombre de ella como de soltero. Tiene que decirlo de casado.
¿Cómo? No importa. Como ella quiera.
Ok, entonces está bien, dilo como...
Ok.
Perdóname.
Virginia Medina Martínez.
Gracias.
Nombre de soltera. Y Montoya, casada.
Exacto.
Yo Miguel Cornelas López.
Y yo Marta Elba Guillén.
Marta Muñoz García.
I don't know who's here. Okay, going to speak in English now, just to save some time in the interpreting. My name is Axel Fuentes, and I work for the Rural Community Workers Alliance in Milan, Missouri, and originally I'm from Guatemala.
¿Cuál es una característica que es importante para usted en un médico que le hace sentir más cómodo como un paciente?
Cualquiera quiere contestar.
Cualquiera puede contestar.
Sí.
Bueno, yo sí les voy a hablar duro. Soy diabético.
I'm diabetic.
Tengo como aproximadamente 20 y tantos años de diabético.
I've been diabetic for like 20 something years.
Yo tenía una doctora, Ivette Tuner, quizá la conozcan.
I had a physician and then
Ella estaba en Maryland, entonces me consiguieron las pastillas de Ibucana. Esas pastillas de Ibucana a la vez me estaban haciendo bien y a la vez mal, porque por poquito me sacan en camilla de la planta.
So, they gave him some medication for diabetes, and he said that they worked for a while, and then apparently it was giving him like side effects, and then ¿qué fue lo que le pasó en la planta?
Yo sé que la ibucana me estaba afectando mis piernas, entonces noté yo porque la línea me caminó muy recio y yo le tiré el agarrón para que no caminara tan recio. Y ya me dice una compañera de trabajo, ¿qué tienes? Dije, me siento, quién sabe cómo, yo siento que la línea camina muy recio. Y me quise retraer para atrás y me almareé. Y ya fue cuando noté que me estaban fallando mis piernas, mis músculos no me sostenían. Entonces llegué yo a mi casa, luego hice la cita para que me atendiera el doctor Mayer, y luego me dieron las pastillas de la ibucana. Entonces en las pastillas de ibucana mi señora me leyó lo que venía en las hojas que dan, y me estaban lastimando mis piernas, mis partes íntimas, dolor de cabeza, y todo me estaban haciendo un desastre porque ya había venido aquí con los especialistas a que me chequearan mis partes íntimas, y me estaban poniendo tratamiento y no sabiendo que lo que estaba haciendo mal era la ibucana.
Okay, so he was given like some medication for diabetes, and one day he was working at the plant, and then he noticed that he had like some like muscle weakness, and then he not only did he have that, he also had like a headache, and he had like other side effects from the medications, and apparently like his doctor was not communicating with another doctor that he was seeing, for which he was being treated for something else, and it was the medication, the one that was causing all the symptoms and all the problems, and that's what he said.
Sorry, I forgot. The question was, what is one characteristic that is important for you to have in a doctor that makes you feel more comfortable as a patient?
Ya le paso el campo.
¿Si alguien más quiere decir alguna característica que deba tener un médico?
Pues yo, los doctores, cuando me puse mala en la planta, lo único que me daban era puras drogas. No me daban para que yo me compusiera, que me hiciera bien. Nomás puras cosas que era droga. Porque yo me tomaba eso y parecía que estaba yo bien borrachita, o que me acababa yo de irme a acabar de tomar una botella grande de vino. Y no podía hacer nada en la casa porque si me estaba tomando esas pastillas y no me componían.
Okay, so the same complaint, like when she would see like a doctor at where they work, I'm guessing it's farmland, like they would only give them medications, and the medications would have side effects, and then they couldn't carry like their daily activities the way they're supposed to, and they wouldn't fix whatever problem they had before. So.
Entonces quieren que su doctor le explique para qué está dando la medicación y qué va a hacer.
Exactamente.
Okay.
Quisiera uno o que le dieran a uno pues cosas que le alivien a uno, no que lo emborrachen a uno o que lo tengan a uno nada más acostada.
Sí.
So yeah, they would like their doctor to explain like what medications they're giving, the possible side effects, so they don't just like go home and then they have like this horrible side effects and they don't know what to expect.
So they see doctors that the company provides?
So ¿ustedes ven médicos en la planta o médicos?
Médicos afuera. La última doctora que vi aquí en Kirksville fue la doctora Gema. Yo tenía mi columna colapsada y tenía hernias y no sé qué más tendría yo en la columna.
So they see both. Like apparently they have doctors when they have like some symptoms at farmland, and they also see like doctors primary care.
Cuando vio la radiografía, ella dice, ay, yo no sé cómo puede trabajar usted, porque ella habla español, con esta columna como la tiene. Entonces ya le dijo, pues dele un disability, dice, para que no trabaje ahorita, que descanse. Y dice, no, ¿para qué quiere que haga eso? Me echo la planta encima. Eso dijo, ahí está él.
Entonces, o sea, mi pregunta es esta: si no se sienten competentes para cualquier lastimadora de uno o descompostura de uno, ¿para qué son doctores? Y la otra, ¿por qué le tienen miedo a la planta? ¿La planta les dará un dinerito extra? Eso es lo que no sabemos.
So basically, the plant does provide them with physicians and nurses, but they work for the plant. They don't work for their patients. So they're gonna, give them the wrong medication or not necessarily report everything that's wrong with their patients. So yes, in theory they have medical care, but do they really?
¿Cuál ha sido el aspecto más difícil de hablar un idioma distinto al primer idioma de su médico? What has been the most difficult aspect of speaking a different language from that of your doctor?
Es un dilema de diario no poderse comunicar uno con los doctores. Porque un doctor con un ansorri tapa todo. Si yo llevo las tripas de fuera, por decir así, por un mal trabajo de él, nada menos aquí tienen este ojo. Este ojo me lo han operado 2 veces. Y cuando hace mucho frío, o que tiran en la planta mucho cloro para limpiar el piso, empieza a llorar. De recién que me operaron, yo fui a la clínica de retina en Colombia. Aquí tienen una sucursal. Y en cuanto me operaron, al siguiente día ya tenía el bill en la casa. De 300 y tantos dólares. Ya voy y les digo, oyes, en vez de que preguntes que cómo amanecí de mi ojo, ya me estás cobrando. ¿Cuánto llevas de tajada? Dice, no, pues tú nomás págame. ¿Y mi ojo qué me lo va a pagar? ¿Qué me vas a dar para ese lloriqueo? No, que se te va a componer el solo. Hasta la fecha ahí está el ojo.
Okay, so he said that it's troublesome, that it's a pain, that doctors usually they say I'm sorry and they don't really listen to what the patient has to say. And he gave the example that he had surgery in his eye. He had surgery twice, and before he actually got home, he received the bill from the surgery, and the doctor didn't call or ask him like how he was doing, and he was still having like symptoms and tearing up his eye. So, ¿algo más?
No, pues hay muchas cosas. Hay muchas cosas. Aquí está otro del doctor de la planta. Me lastimé yo mi brazo y voy al doctor porque al levantarlo me truena. De primero que me vio, dice, va a haber necesidad de operación. Ya se me pusieron los pelos de punta de por qué que no tengo pelo. Me van a operar. Entonces ya nomás supo que era de la planta y se acabó la operación. Así como miran ese papel, así se acabó.
So he went to see like one of the doctors at where they work at farmland, and he was complaining of like shoulder pain, and he had like some like weird noises in his shoulder, and then the doctor apparently told him, oh, you need surgery. And once he told him that what he worked for, then the doctor decided like not to do the surgery, that it wasn't necessary. So
me llaman a la planta, me haces una cita con el doctor, la enfermera y yo. y ya me dicen, tú no te lastimaste aquí. Que tú no te lastimaste aquí, me señala. Y yo volteo para los lados, pues a quién le grita. Entonces ya le dije yo al intérprete, dile que si quiere ir a ver donde me lastimé. No, que tú no te lastimaste aquí. Tú puedes decir lo que tú quieras, pero tú no te lastimaste aquí. Ah, bueno, entonces si no me lastimé aquí, ¿para qué me citas aquí? Y ya lo único que dijo la enfermera de la planta, como no había evidencia, no me podían curar.
So after that incident of the shoulder, the same story, like he was called apparently by the physician of the plant and the nurse, and there was an interpreter, and they told him that they were not responsible for whatever injury he had in his shoulder, so therefore they were not going to do the surgery or take care of it, and that he had no proof that he actually got injured while he was working there, so therefore they were not going to do the surgery.
Ándale, doña Marta, échale.
¿Qué? ¿Qué le he hecho yo? No, pues yo pienso de que sobre todo el lenguaje, no hablar bien el lenguaje, el inglés, pues muchas de las veces a lo mejor los doctores, bueno, por mi verdad, no no le entienden a uno. No, uno no sabe explicar lo que uno les quiere decir. Como hace poco me hicieron una cirugía en la rodilla y fui yo al doctor y siempre desde un principio cuando me hicieron la cirugía me pusieron un intérprete y ya las demás veces que he ido a citas no me tienen intérprete. Y el doctor me mandó, después de 2 semanas, me mandó a trabajar a la compañía y me regresaron que porque como traía yo andadera, que no podía andar allí con esa andadera porque no había sido una lastimadura de ahí de la compañía y me regresaron para mi casa. Entonces yo esta última vez que fui al doctor, el doctor como que se molestó porque me dijo que él me había dicho que me fuera a trabajar, que por qué no estaba trabajando. Y no le pude yo decir que ellos me regresaron para la casa porque no había quien me interpretara.
Okay, so she was seen for like apparently knee pain, and then she had surgery for the knee, and she's just talking like how difficult it is to like communicate with your doctor, right? And apparently at the plant where they work, they told her, so after the surgery, they put her on
a walker.
Yeah, they put her in a walker. And then they told her at the plant that she couldn't use the walker around the plant, so she had to stop using it. And then she went to see her doctor, and she couldn't properly tell him that they wouldn't allow the walker at the plant, and that she couldn't use it. So again, it's like a communication issue between like the patient and the doctor. And she also said that initially she had an interpreter, and then when she went to see her doctor again, they didn't have an interpreter. So.
Well, I'm going to say something too. Regarding the first questions that you asked, and one of the characteristics that make us feel comfortable, first is, of course, is knowing that the doctors or nurses or the healthcare providers are going to be understanding us. Obviously, when you speak another language, that's a very difficult to feel that way, especially if has a lot of things to get involved. Also the attitudes too, sometimes culture. So if you don't feel comfortable with the doctor, or the doctor doesn't feel comfortable with the patient, since then I think establish the first barrier. I know that doctor could be with a really good intentions to help the patients, but sometimes that doesn't happen if either patient and doctor feels uncomfortable. So just for what they were saying regarding when a doctor works for a company or works independently, just doing the kind of work that I do and working in the community, that's one of the biggest issues that I have found, that obviously if you work for the company, you don't want to hurt the company. If you are a doctor working for a company that is paying your salary, or somehow you are getting a benefit for that employer, you are going to try to be more on their side than the worker side. And this is like a Milan or other communities that has meat processing plants. This is very common. Workers getting injured constantly in the companies or getting injured in the plants, but the company is not taking responsibilities. And doesn't help, especially when a doctor also is going to diagnose something like, for example, in part of my job, I have found cases where people are injured, like repetitive motion things, and they are being diagnosed with arthritis, for example. This is very common, so it's something that is not helping the patient, and it's not ethic for the doctors.
It's not like the mother I mentioned that lost her job, it was due to a medical issue that was causing her to be unable to do the motion that she needed to do, and that was kind of like the last piece of information that caused them to fire her. Yep. So it's like really complicated, but yeah.
It is. And well, another thing is you have to remember that a patient that is not being diagnosed correctly, sometimes the doctor is totally destroying people's life. There is many cases in Milan where workers actually lost their houses, cars, got terminated from their jobs. They couldn't continue letting their kids to go to the school. So many things. It's not only like, this worker didn't got injured in the company. That doesn't end just right there. So it goes beyond that. Goes beyond to destroy actually in some cases their families too, because cause a lot of stress, a lot of problems in between inside the family, inside the house. There are some cases that actually just one of the cases that we have now is just a person that the doctor diagnosed wrongfully this person, so we have to go with 4 more specialists that actually to get opinion, just to get the right diagnosis for this person, But this person now is mentally even sick because for all the stress that she have passed by these 4 years since she got injured in the company, but the company never took responsibility. And also the first doctor that she went to visit was a company doctor, and the doctor said, well, no, she didn't got injured in the company. She has an implant in the shoulder, an implant that never existed. Even MRIs or never is not showing anything there. But she's still struggling to survive pretty much, because she got terminated. She can no longer be hired by the company again, so and has been passing for all this litigation period that she lost her house, she lost her car too, so many problems are bringing that kind of issues.
Always remember we have a very privileged position, and that comes with a lot of responsibility, and don't ever take that lightly.
Axel, does the company get away with that because the workers don't have the money to pay for the legal battle that would?
In many cases, yes. In many cases, yes. If the workers has not the money to keep fighting, if they cannot be patient too, so yes, the company just get away. And in many cases, even workers since the beginning, they just said, no, I don't want to fight because this company, anyways, is not going to take responsibility.
It's like the advocacy thing. It's the same thing. I was saying in the school, in la escuela, there's like not a how do you demand for things to change? It's hard. And it takes energy, and they're working 12-hour days, and it's it's money and energy.
Yeah. And besides, there are other issues that could be related to, like for example, in if we can say immigration status, for example, that makes in many cases that the people don't want to proceed because they feel fear, or of course the retaliation too from the company. Especially in isolated places or in rural areas like Milan. If you are bringing your family to Milan because you got the promise of having a job, and then you have a job for 3-4 years, you decide to buy a house in Milan so to get established, and then you get terminated, so it makes your life really, really hard.
¿Cuáles son las barreras a las cuales se ha enfrentado usted, lingüísticas u otras, en el encuentro médico? ¿Puede dar un ejemplo específico? ¿En alguna ocasión se le ha negado acceso a la cuidado médico por causa de estas barreras? What are the barriers that you have noted, linguistic or otherwise, in the medical encounter? Can you give a specific example? Have you ever had access to healthcare denied because of these barriers?
No los niegan, nada más que muchas veces nos dicen, lo citaron en tal parte, pero tiene que llevar su intérprete si quiere entender.
So they don't deny access. They just tell them that they have to bring their own interpreters to the appointment.
Nosotros a veces le pedimos de favor a él o pagamos o según como podamos, vamos, pero.
And it depends. Sometimes like they pay someone to go with them, or they ask for help.
Just to clarify, I'm not a certified interpreter, okay? And as you can hear, my English is still, need improvement. But and especially in medical terminology, it's sometimes hard. And I will say, in some point, yes, the service is being denied because if the patient is not bringing interpreter, they are being sent back, and go and find for your interpreter, and with them, when you find interpreter, come back. Especially when people do not feel comfortable with interpreting by phone, and that's one of the reasons that in many cases that I found out that they say, well, we are providing interpreters by phone, but ask them how many of them are actually satisfied with with interpreting by phone.
¿Cuánto a ustedes les gusta eso del intérprete por teléfono?
Pues hay veces que no.
Pero
mi pregunta es esta, o sea, por teléfono la persona que me va a estar interpretando no le va a poder estar yo haciendo señas donde me duele. Tiene que estar presente, la persona va a decirle yo, dígale que me duele en tal parte, pero por teléfono ahí no me va a estar viendo, me va a estar oyendo la voz, pero no me va a estar viendo.
So over the phone, they're going to be listening to what he's saying, but he's not going to be able to express himself and tell him, oh, it hurts here, and he's actually like looking at them so he can actually express what he's feeling.
Les voy a platicar lo que me pasó con mis lentes. Nomás no se vayan a reír, ¿eh?
También los míos.
So he's going to tell us like what happened with his eyeglasses.
Resulta que se me quebraron mis lentes. Los lentes me costaron $380.
So he broke his glasses, and they initially the cost was like $380.
Llevo los lentes quebrados y dice, ahorita te los reparo.
So he took them so that they would fix them.
No, ya llegan con ellos dice, no se pudieron reparar, pero te podemos hacer unos.
So they told him that they couldn't repair them, but that they would make him a new pair.
Ya dije, como a cuáles me podrían dar, de los que compra la aseguranza. Mira, estos te los va a cubrir la aseguranza, estos no. Estos, tú tienes que, si quieres que se te hagan oscuros, tienes que pagar. ¿Cuánto voy a pagar? No, pues te va a salir como en 200 y tantos dólares. Si se me vuelven a quebrar, ya no van a tener reparación. Así nada de que mejor dame estos que cubre la aseguranza, para que en cuanto se me quebren, me das otro luego. Y se enojó la doctora, o la que me estaba atendiendo. ¿Sería doctor o sería secretaria? Se enojó y los lentes me los iban a dar en 2 semanas. Tardaron 4 o 5 semanas, y eso porque yo fui a llevar a ella a los lentes. Que a ti te estuvimos llamando. A mí nunca me llamaron por teléfono para... Yo entiendo de que si me llaman por inglés, que me digan los lentes, glasses, sí entiendo lo que quiere decir glasses, pero nunca me llamaron, y con eso se lo sacaron. Un I'm sorry, nosotros te llamamos, no contestaste el teléfono, no es la bronca de nosotros.
¿Los primeros espejuelos o los segundos?
Los segundos. Y hasta lo que no vine a molestar al ser, fue del modo que me dieron los lentes.
So he the initial glasses, they were broken, right? So he took them and they showed him like different types, and he asked, oh, which ones are covered by the insurance, which ones are not? And then they told him that the ones that were not covered by the insurance, they were like $280. But before, like they didn't replace the glasses, so he decided to take the ones that were covered by the insurance. And he's saying that he went through a lot of trouble to get the glasses because they didn't call him and they didn't tell him, oh, the glasses are ready. So he waited for like 4 weeks so he could finally have his glasses, and they didn't even bother like to call him and tell him. They just told him, oh, I'm sorry we called you, but they didn't actually call him. So.
Y a mí también me lo hicieron, porque ese día que vine y que se los dieron, a mí me estuvieron mandando una tarjeta de que ya era tiempo de que viniera a que me hicieran los otros lentes por el AHEC. Y le digo a él, pues yo creo que sí, ya vamos, ya tengo como 2 años para que yo tenga otros de repuestos. Y dice, vengo. Y dice, sí, ya le hace falta que me toma las medidas. Le digo, pero tengo el AHEC. Dice, sí. Ya que me tomó las medidas y me hizo todo, me dijo, le van a salir en $200. Le dije, no tengo dinero. Yo le dije que era por el AHEC. Y dice, no, dice, si viene entonces dentro hasta septiembre o diciembre, me dijo, entonces sí. Pues no me dieron los lentes y ya no vine porque me dio coraje de que primero me están llamando y luego me salen con que tenía yo que pagarle.
So she had the same problem. Like they were actually calling her to come in, and then she came in, they got the measurements, and then she told them that she had Medicare, and they said that they wouldn't take Medicare, and that she had to pay like $200 and something for the glasses, which she didn't have that amount. So it's frustrating that they're calling her, and she thinks that they care about them, and then she comes in, and they only, like if she didn't pay, she didn't get the glasses. So.
Y como ahí nomás me fui a medicinar a México, porque allá me voy a que me vean otros doctores de allá, porque yo siento más alivio allá que aquí. Me mandé a hacer los lentes, porque si no, ya no tuviera lentes.
And then she went to Mexico because she feels more comfortable there, and then that's where she got the glasses.
That's another thing that happens. I think the problem with lack of interpreters is not starting just at the moment when the patient goes to the clinic. Actually, it starts since before, because in many cases the patient needs to make an appointment, and if there is nobody at the healthcare provider office that can communicate, they cannot make appointments. Then they have to sign documents, particularly documents that they are not going to understand. Then they need to follow instructions in how to take medications, for example. They will not know how to do it. In many cases, that I have here, people are, well, when they came to me or, hey, please read this. So I'm reading after maybe a week that they were taking medications in the wrong way because they couldn't understand. So, and then sometimes, I don't know, maybe the doctors want or they are willing to provide good service, but by the other side, I think there is much about money, you know, because with some clinics that I have talked on that, I say, well, why you don't provide interpreter? I say, because it costs money. And but on the other side, it's also a way how healthcare providers are losing business too, because some of the people are going to Colombia, for example, or even going to Kansas City, you know, because they are going to find out that there they are going to feel more comfortable because interpreter is being provided. So I would think in the surrounding area, sometimes people are going just because honestly need to go, but not because they really want to go there. It's not that way like, well, I'm going to this doctor because I'm feeling comfortable there. It's not that. I'm going to this doctor because I have no other choice. You know, because it's close to the place where I live, because it's close to the area, and then they cannot take many days off out there in the plant. So that's why they are actually ending going to some clinics that are not providing interpreters. You know, and I had the luck, you know, my English is understandable, I think, and in many cases, but still, there are some cases that I don't understand many words too. So.
Question for you, or for anybody else that knows, do you know if it's legally required for doctors to have interpreters? Because I know in hospitals it's pretty much legally required.
Wherever institution that is receiving federal money, they're supposed to provide interpreters. But legally, how they can get away with is if they provide the phone service. You know, if they are providing phone service, that's considered interpreting service. You know, so legally, that's how it is. But I think, regardless of being legal or not, I think will be the what is that you guys actually do when you graduate? That when you
take the oath.
So I think because you want to provide the best of your abilities and the best of the service to the patient, right? So forget about the laws, because we're never going to find probably the laws that are really going to satisfy our needs. You know? So, but I think it's conscience sometimes.
How much access to transportation do most of the people of Milan have? Do a lot of them have cars, or do they have to walk to work, or can they get to Kirksville easily? Or
I would think that now, before was, if I can think about 6 or 7 years ago, situation was totally different. Most of the people now can come, they can drive and come to Kirksville, but there are cases where the people cannot drive, and it's really hard for them to come over here. Well, actually, don Miguel, ¿por qué no le comparte cuando usted vino a su cita también y tuvo que regresarse, que no lo atendieron, no?
Mira,
I'm going to let him share some.
Eso fue lo único que me dijo, siéntate por favor.
That's the only thing that they told them in Spanish.
Llegué yo, me senté, pero ya antes de que me sentara me había tomado mi paseíta porque me iban a dormir, porque me iban a picar allá mis partes íntimas. Y ya se llega la hora de la cita y ahí no, yo preparado. Ya anda que ya cuando me quise parar, pues ya borrachito,
Sí, por la pastilla.
ya por la pastilla que me tomé. Dice, ¿sabes de que no te vamos a atender? Y ahí ando buscando hacer puentes, ¿dónde está? Pues para que me dijeran por teléfono. ¿Y dónde está? No, pues que no. Un momento por favor, hasta que me lo hallé. Y ya dice, ¿sabes de que no lo van a atender porque le estuvieron avisando que no, el doctor no iba a estar Pero a mí nadie me avisó. Entonces yo ya bien ajeringado, y ya que hacía, pues nomás colgar el pico. Y le taparon el ojo con $10 que me dieron.
Para la gasolina.
Para la gasolina, para que no viniera de balde. Pero si no sea por él, hasta la fecha ahí me tuvieron todavía esperando.
So he came to an appointment, and apparently they were going to do a procedure. He took the medication that he was supposed to take before the procedure, and then he took the medication, he did everything he was supposed to, and then they told him that the doctor was not going to come in that day. So and then they just told him, "Oh, I'm sorry, we called you," and they didn't call him, and they didn't tell him that the doctor was not supposed to come in. They just gave him like $10 for gas so that he would go back.
And the medication was a sedative, so he was in no condition to drive after he took it. Which would have been really good information to have beforehand.
Yes, but the thing doesn't end up there. It's just think for a moment that a patient that has an appointment needs to take a day off probably, or leave earlier from work, so needs to take a 2-3 hours off from work. And especially for them, taking a day off means not only that they lost the payment for that day, they actually are losing bonuses too, because they are accumulating negative points. And if they accumulate 6 negative points, they can get terminated. And regardless of bringing the paperwork that they attended an appointment with a doctor or hospital, anyways, they get a negative point, even having the document.
How many points do they get per year, Axel? ¿Cuántos puntos les dan al año la planta?
¿Hasta cuántos puntos pueden acumular por año?
6 a year, essentially.
Y ya con 2 horas y media que te salga ya no te dan bonos.
If you are gone for 2 hours or more, then they give you a point.
You don't get the bonuses.
And the bonus, yeah.
You lose your bonuses. So.
A mí por 15 minutos no me dieron.
For 15 minutes, like, she didn't get her bonus.
Ahora la línea ahí está tan recio que cuando empieza uno de nuevo dice, oh, está despacito. Pero en la mañana empiezan con 19, 20 puercos por minuto. Va pasando el tiempo y hay un numerito que va brincando. Ya no son 20, ya son 22. Más tarde, ya a la hora del break, ya está de 23, 24 marranos. Yo así saqué la cuenta. 19 por 60, 20 por 60, 22 por 60 y 23 por 60, que viene siendo aproximadamente como 1000 y tantos marranos por hora. Ahora ya no trabajas por hora, trabajan a gorro quitado. Es un decir. Allí conmigo las piezas van así de retirado. Vamos a ponerle 8 pulgadas, que viene siendo lo que corre el papel. Entonces aquí va una pieza, aquí va otra. Ya no lo quieren así, ya lo quieren así. Realmente no es por hora, es a destaco por lo que tienen los tapos.
Sí. Pero la señora también trabaja.
Sí, la señora tiene un trabajo más pesado que el que yo tengo.
Yo trabajo ahí en la línea de picnic. En mayo 21 cumplo 8 años de trabajar con cuchillo. Pero ahorita han puesto que yo creo que, si no me equivoco, están sacando doble producción, así como está de recio. Porque fíjese que allí en mi línea está una señora que se llama Doña Martina, que ella siempre que ella no se puede acelerar de lo recio que está porque le pega se asfixia y empieza ya así. Entonces ella está primero que yo y yo después de ella. Entonces a mí me toca jalar todas las piezas que ella deja ahí porque ella está despacito y la línea está así. No, hombre, en un ratito lleno la cubeta y lleno acá. Y sabe, de estos días, sabe lo que me hicieron. que donde mi supervisor, que yo estaba bien amontonada de jalar todas las piezas, me pasó para la última mesa y adelante de mí puso una morena que no está contando, no está jalando cuenta todavía. Y allí siempre dejan ir las piezas. Y luego después me pasó para la última mesa y llega el casco rojo y me dice, véngame, sálgase. Y ahora a la oficina, me dijo. ¿Y sabe qué hizo el supervisor? Me rayó. Y yo no sé por qué, porque yo estaba trabajando como siempre recio y me pasó para la última mesa y luego me llevó a la oficina el casco rojo a que me rayara. Y ella, el casco rojo, se puso en contra mía, que sí, que dice que usted llega tarde, que usted se amontona porque llega tarde. No es cierto, de pura maldad, mire, me rayó el supervisor. Después de que yo hago trabajo de más, eso fue lo que hizo. ¿Sí? Y luego porque yo fui a recursos humanos también, el supervisor, yo siento que le caigo mal, porque solo conmigo está como que es policía. Él no chequea. En la mañana estaba ahí parado viendo que uno está, pero así, se le va a plantar ahí y va de verlo. Y me volteé yo y le dije que se fijara allá, que chequeara allá adelante, le dije. Porque solo a mí me está mirando. Digo, ¿será que le gustó cómo estoy? Estaría ahí jalando piezas que no son mías. Sí, el supervisor está bien, pero yo siento...
Pero nosotros tenemos la culpa por hacer lo que no nos toca. Porque
sí, pero ¿sabe por qué lo hago yo? Porque él solo a mí me ve a ver si dejo mi pieza, él está allí. Y luego me llama la atención, dice que yo trabajando de más. Bien injusto.
Perdona, mi amor.
Eva, espera.
Por favor. Aquí hay una.
Okay, so I'm not familiar what they actually do with the plan, but apparently they work in lines and then
They'll be like you'll hear my parent works on the ears, or like they have specific parts, and so they do the same cutting motion every single day, and she's been doing it for 6 years.
Right. And then she's saying that she works in the same line for 6 years, and now they have increased the workload, and she has tried to like keep up and keep doing the same work. And her supervisor just decided to like take her out of the line and put her somewhere else just because he wanted to. And then she went to talk to him, and he didn't give her a reason. He just decided, oh no, you're gonna work doing this. ¿Cuánto dice que los rayó que?
No, strike. She got a strike against her. So there's like certain numbers. Yeah, so they get 3 strikes before they can get fired. So because basically the person before her wasn't moving as quickly, so her work was piling up, so she couldn't keep up. And so she got a strike for not keeping up. And she thinks her boss is against her also. Anyways, but they do, like a medical thing to keep in mind is that they do the same physical motion, and oftentimes they're very small, like repetitive, at a crazy rate every day, and usually it's for 6 years, and usually they don't, Axel, correct me if I'm wrong, they usually don't move from different part to different part. Like if
they are not rotating.
Yeah, once you're on the ear, you're on the ear. You know what I mean? So it's really the same movement.
Yeah, and this plant's repetitive motion is very common, and then you get stuck when you have to claim for compensation because a doctor said that no, it's not a repetitive motion, it's arthritis. The doctor that works for the plant. And then people's lives are destroyed.
Y son 10,500 marranos y a las 3:15, 3:20 se acaban. Y cuidado porque te vayas al baño, porque nos dieron una lista que nomás podíamos ir una vez al baño.
So they gave him a list that they could only go to the bathroom once.
Por semana,
Sí.
3 veces, no más.
3 times. They could only go to the bathroom 3 times a week.
Y ellos sí pueden salir a la hora que se les antoja.
And the supervisors can come and go as they wish.
Y los que son gringos.
Los cascos rojos.
And that's going to be also an important medical thing here because regarding the bathroom breaks, and I have read some of the restrictions that doctors are giving to them. You know, many of, especially pregnant women, you know, needs to go to the bathroom often. You know that better than any of us here. So, or someone who has a kidney problems, or someone who needs to take a medicine, for example, needs to take water too. But the company is not allowing them to go to the restroom, so they, in many cases, they just say, well, I'm not going to take the medicine today because I cannot drink water, because if I drink water, I have to go to the restroom. And just with some restrictions that actually I have seen that doctor said, the restriction actually reads like, for example, Mr. X, he needs to go to the restroom 2 times a day. So what happens is, the company said, well, no problem, because we are giving them 3 breaks. They say in the morning they get a break, lunch break, and then afternoon break too. First break, yes, they get a break in the morning, 15 minutes. Second break is a lunch break. And then the third break, they are only getting that if are going to be working more than 8 hours. So during the 8 hours, they are not getting. So it's really easy for them to violate the restriction, you know, because they can say, well, yes, they are taking the breaks. So I think the doctors needs to be specific, like saying in the restriction, okay, this patient needs to go to the restroom 2 or 3 additional times, you know, plus the already scheduled breaks, you know, and, because no one of us can program the body, you know, you're saying 8:30 restroom. So it's not like a program. So you go when the need comes.
Pues ahí hay mucho problema, la verdad. Yo tengo problemas ahí porque me he enfermado porque anterior no dejaban que uno fuera al baño. Si uno les decía, necesito ir al baño, otra vez, y no lo dejaban ir a uno hasta que ellos decían. Y yo me he enfermado ahí, fui al doctor y me dijo que mi vejiga estaba desnivelada por tanto de aguantar ganas de ir al baño. Y todavía tengo descripción allí porque fui a la doctora y me dijo que yo no aguantara, pero estoy igual porque hoy un casco rojo nuevo que ha entrado allí. No, hombre, él, yo creo que se cree mucho, está igual que su supervisor, se está enseñando él.
A ese supervisor no le puede decir nada.
Se está enseñando él de lo mismo que el supervisor. Le digo, Oscar, necesito ir al baño, no aguanto. Espérese que va a ir fulana. Un día estaba allí trabajando, dando brella ahí donde estaba yo, y le dije yo, antes de que se fuera, Oscar, necesito ir al baño, le dije. Espérese que le voy a dar a la abuela que está allá, me dijo al otro lado. Y yo estaba aquí, ya no aguantaba. Entonces me fui yo porque le digo, ¿qué hago? Yo tengo que ir al baño. Cuando regresé, bien enojado. Yo le dije, me dijo que le iba a dar brella a la señora allá, me dijo, y usted se fue, me dijo. Pero bien enojado. Sí, le dije, porque no me puedo aguantar. La doctora me dijo que no me aguantara y fui a recursos humanos y le puse queja. Y desde ese día el supervisor la trae conmigo.
So yeah, she's had issues with like urinary retention in the past. Like she's had bladder infections and such. So one, you know, lots of times she's asked the supervisor if she can go to the bathroom or not, and the doctor told her not to wait. And they've always told her no, and like when you gotta go, you gotta go. So she went once, and when she came back, the supervisor was very, very angry with her. So these are not great conditions to be working under.
Yeah, so this is another medical thing too. That at this point you probably are thinking, well, why these people don't proceed legally? Because there is not actually law that stipulates how many times in an 8-hour period of work a person needs to go to the restroom. So the law only requires to employers to have bathroom facilities. if they have bathroom facilities, they are fine. So there is not a problem. But the law doesn't specify that the workers needs to use those bathroom facilities. So they can have bathroom facilities, and that's all. So there is no other specification on the laws. Same thing with regarding the speed of line, that actually causes them a lot of the repetitive motion problems, is because there is not an institution that can regulate now the speed of line. And there is not a law actually that stipulates how fast the work line needs to run. It's actually USDA in some point can regulate the lines, the line of work, the speed of line, but it's only if it's been a threat for the product. So that means if the product is, because it's too fast, the product is not getting well, so they can slow down the line. But if it's a threat for the workers or putting the workers in danger because they can get injured easily, that means problems for accidents or repetitive motion injuries, so there is nothing now there.
Okay. Pregunta final. ¿Qué consejo puede ofrecer con respecto a la cultura a futuros médicos? What advice can they offer us in, with respect to culture to us as future physicians?
¿Qué consejo le da a nosotros que somos médicos en el futuro?
Ay, que fueran bilingües, que supieran el español para nosotros.
Sí, porque,
Be bilingual.
Como dice, bueno, a veces, espero me perdone se puede decir, ¿cómo les puedo decir acá? La expresión, porque la verdad las cosas de que el americano puede decir, bueno, está en United States, tienen que aprender inglés. Entonces, pero yo sé de que el inglés para nosotros es bastante difícil para desarrollarlo, porque yo estuve estudiando aproximadamente 3-4 meses y no se me fue fácil. Tengo dificultad, pues no me puedo desarrollar en inglés, ni me puedo expresar. Entonces es bastante difícil y es muy importante de que haya una persona pues bilingüe en cualquier área para que le ayude a uno, ¿verdad? Yo sé que estamos en este país y es una responsabilidad llevar la segunda lengua o la primera lengua de acá, pero lastimosamente se los es difícil para desarrollar, ¿verdad?
Para algunos, porque hay muchos que sí son muy inteligentes,
¿verdad? Pero no todos, porque en ese gremio como que batallo yo, y la verdad las cosas de
yo creo que todo el mundo batalla.
Yo tengo años, sí. No salgo de las mesas, de las sillas, del piso.
So, they're saying
También una que otra palabra, nombre, porque yo fui a la escuela 3 meses y me enseñé los nombres de la silla, lo de la cocina, sí. Pero ya establecer una comunicación, un diálogo, pues.
Sí, y también el trabajo
por ejemplo,
toma mucho tiempo, entonces después que terminas el trabajo tampoco van a querer sentarse en una clase y decir,
So they're saying that they've encountered, like, you come to the US and they're like, oh, you should really learn English. I mean, they've tried. They've gone to classes for months and months, and English is a very difficult language to learn as a second language, especially as an adult. And she said, like, a couple of classes she went to, they were like teaching her like vocabulary for things in the kitchen. That's not really going to help her communicate. So it's really helpful if we are bilingual, if we have interpreters to help them out in whatever way we can, because they are trying, but they also work 12-hour days. So you are asking a lot of them.
Sí, pues yo opino que tiene que haber intérprete en los hospitales, en las clínicas, un intérprete permanente, en las clínicas, en los hospitales, porque imagine que uno va a Colombia, porque en Colombia están todos los especialistas, dicen, me ha tocado ir para allá Y he venido aquí a Los Lentes también, he traído intérprete a Colombia también. Y allá en Colombia, miren, nomás por el copay $40, ¿sí? Y pues siempre llevo intérprete, y yo pienso que debe de haber en los hospitales, ¿verdad? Porque a veces uno encuentra intérprete, a veces no hay y pierde la cita y pues se pierde, ya no va uno a consulta. Es necesario, pienso yo, que hay intérprete, porque por teléfono, porque hace poco vine al Seguro Social con el señor aquí Excel, me trajo ahí, y pues yo preocupada que por teléfono, y por teléfono yo no me sentía bien, porque por teléfono, y solo por teléfono, pero gracias a él que él me llevó al Seguro Social, y pues, sí, remedié ahí el asunto.
Gracias a Dios.
Sí, gracias a Dios que me llevó.
Pues él ha sido nuestra salvación.
Sí, todo él, mire, si él tiene tiempo, uno lo busca con tiempo, él no se niega, él es muy bueno, mire, él
Pregúntenme a mí, me acomodó mis ojos. Gracias a él.
Él es muy bueno, él siempre
servicial.
se preocupa por
Bien
servicial con todo. Cuando le hablan con tiempo, vea que él tiene tiempo, él no se niega, él que se puede sentir él.
Y si no tenemos dinero, pues nos hace el favor y nunca nos cobra, nunca nos cobra. En cambio
Él no
buscamos
cobra,
un intérprete,
él siempre
el
no
intérprete
cobra.
lo tenemos que pagar.
Él no cobra, él dice, no, yo no le estoy cobrando. Dice.
A mí me salió en $280 la ida a Colombia. Los ojos. En menos de 15 minutos.
Sí, eso.
Ya, lo que se tardó el carro de Mailand a Colombia, 15 o 20 minutos allá, vuelta para atrás. Ay, me llevas a comer, ¿eh? No quiero ir a cualquier changarro, me llevas a comer y ya no vamos.
Ajá, los intérpretes.
You better not leave any of that out. No. You can tell me about that.
So they're saying like having interpreters is vital because a lot of them go all the way to Colombia to get their care, and he's traveled from Milan to Colombia for 15 minutes for his appointment for his glasses, and then he has to come back, and he's missed probably a whole day of work for that. So if possible, have a physical person interpreter there. Because over the phone is also very difficult. So just keep that in mind in the future.
And advocate. I don't know, I guess this is the teacher in me because I'm constantly trying to advocate in the school. And it's you as physicians have so much power politically in the hospital as well. Advocate for human interpreters, right? So it's just know that you can do that. Because I'm constantly doing it at the school, and I'm the Spanish teacher too. We're a 2-woman show over there, but you guys should do it too.
Well, my advice for you as a future doctors will be, first of all, just remember why you decided to become a doctor, and practice with honesty, with honesty, and with passion for what you actually are now going to school. I know that it's expensive, your careers, and you may end in a big death at the end of the school, but something that I always have seen, well, I got lucky because in my case, my personal doctor is a really nice person, but in many cases, honestly, when I took some people to some clinics, I can see that those doctors are it's no difference from the plant, those doctors that are fast, and boom, just is there anything else? No, any question? No, boom. It's I don't know if they have a quotes that they have to do or something, but for me, just providing the interpreting service is man, I don't want to be in their feet sometimes because it doesn't like that. It doesn't work like that, But I will. My advice is practice honest, and just remember what you are swearing for. always keep that in mind. That's my advice for you guys.
Thank you. Any questions from anybody? No?
I had a good final question that is probably yes or no.
Go ahead.
Would any of you eat the food that you make at your plant?
¿Comerían ustedes la comida que hace en la planta? ¿Ustedes?
No tenemos de otra.
No, pero la comida que hace la compañía.
La compañía, allí, este aceite lo tienen ahorita que dice que se limpió. Ya con eso.
Como que
O sea que ese aceite, ahí hacen la hamburguesa. Ese aceite, ahí hacen pescado. Ese aceite, ahí hacen papas.
In other words, he would, and he's talking about like the grease, and they put like everything there, and he wouldn't. So,
No, muchas de las veces que tantitos flojos para hacer de comer y si no la comemos, a tiras y tirones.
I think they're thinking about
I stopped actually buying from them. I used to, but when after I conducted my first stage of the listening process, I stopped buying actually meat in the stores because what I have here. But in many of the cases, I think has to be also with for them for prices. You know, if you make a low wages, you gotta go and find something that you are going to buy for cheap. You know, so in many cases. But personally, after I hear many stories from them, I'm not eating that meat anymore, and I won't give that to my kids. Never, ever.
muchas gracias.
Gracias.
Ojalá que sean muy buenos doctores. Y que no nomás receten puras drogas.
No, una que otra.
She hopes we'll be really good doctors.
Sí, sí, sí queda. No.